Good morning, everyone. Pat Zemer here with MagnaWave. Tuesday morning office hours. Every Tuesday, 9 o'clock, we come together, visit for a little bit, talk, answer any questions that you may have at this time with regard to MagnaWave, PEMF devices, training, anything that you might want to visit about. Got a couple of things today that people have asked me, and thought we might want to get into them. And also I want to talk a little bit about a lot of folks are dealing with, there's been a lot of conversation about depression and the results of depression and suicides and so on and so forth. So maybe we can go there a little bit and have a discussion about MagnaWave. First, I had a friend, actually a friend of my brother's. They were talking, and my brother's friend, and this guy's a friend of mine. It gets kind of confusing as I talk about it, but at any rate, his wife's having some knee problems, and she's had it for a long time. And so I talked with him about they wanted to have knee replacement or knee surgery, and the question is, can MagnaWave help? Can it be beneficial for her to give her some relief, and can it stave off necessarily having to have the surgery? And my answer is to that it just depends how severe the indication is, how long the person has had the indication, and how bad it is, and how much things have deteriorated to, when they have the conversation, bone or cartilage depleted, or any number of questions like that. And so, I told him that it could work. It could give some positive result. We've had a lot of folks that have been in those type situations that have put their need for surgery off for a great period of time. Some have avoided surgery altogether simply by keeping the area uninflamed, keeping the blood flow good, so there's no pain and it doesn't deteriorate anymore. A lot of times when we talk about arthritis and the buildup of calcium and how inflammation gets in the way of various indications, if you can keep the inflammation at bay and keep things in a healthy state, you can keep something from getting worse. You're not necessarily, this isn't going to go in when we talk about arthritis where you have inflammation or you have buildup of calcium around a joint, and it's irritating the nerve and causing pain and inflammation and lack of movement. This device will not do away with that calcification. Can it slow calcification down, or the buildup of calcium? Can it keep it from getting any worse? We think so. With good oxygenation and good blood flow, that seems to be what we have seen and what the situation may be. So that begs to bring me to the point where we're talking about, and my wife Dee Dee and I were talking about this morning before I came into the office and got ready for this particular program. Good morning, Linda. Thanks for joining us. But what people could do if they would if they know they're having, when they're in their 30s or early 40s, and I've got some bad knees, or they're starting to get worse, or my back is a perennial problem, or could become a perennial problem, why not start treating early? Our conversation this morning, what about when you deal with dementia and the possibility of Alzheimer's, and that's a buildup of plaque in the brain, it's an inflammation in the brain. And if you couldn't just be treating yourself continually, or being exposing yourself to this type of therapy continually from an early onset age, if you will that prevent things from coming? That's the whole deal. And when they talk about PEMF and how it's used in Europe and various places, is prevention as much as relief, relief and helping something from that perspective. So if we can treat, can we slow down something? Can we prevent something from happening? And so, but we don't do that. You talk about people that have bad knees and they go to the doc and say, well, I'm not throwing docs under the bus. There's just not a lot else that can be done. But you go and you're having problems, and the thing is, well, hopefully take care of it, and we'll put it off as long as we can. We don't want to do this if we don't have to. And what people periodically do or typically do at that point is they just deal with it for a number of years before it gets to be a problem. And that's the time probably to step up to the plate and begin begin working with it with a device to help you have good blood flow, keep the inflammation down, and maybe you'll stay healthy on your knees a lot longer. Maybe you won't have to have that type of procedure at all. And we found that with animals and hip dysplasia, if you treat them, a lot of times you can keep things from becoming problematic and necessarily having hip dysplasia surgery. We did it with our boxer. One hip was gone, and the doc said, "Yep, we're going to have to do it." And then, of course, you're going to have to do the other hip, and just and our dog was 60 pounds, and not so easy to carry it around for 6 months or deal with it. And we treated it, and the dog never had to have the surgery. We had a problem when she'd go outside and chase a rabbit or something, then she'd come in gimping, and we'd have to treat her and get the inflammation down, get the pain relieved, and then she'd be fine until she would do something again to exacerbate the problem. Kind of like gardener's lament. You go out and work real hard in the garden all weekend, and you've got a sore back or sore knees, and you need to do something about it. So I'm rambling there a little bit, but the thought being, a lot of times we talk about using this particular device to relieve pain, take away inflammation, help things be better. We also need to look at it from the standpoint of what you can use it to keep yourself healthier, to not have problems down the road, to use it to keep your animals healthier as they age and they have those types of situations. And that's the way it was for us when we started and with the race horses and the performance horses, is we used it as a pre-race or pre-event therapy or modality to help them have better range of motion, to not have pain, to be able to run fast longer, the whole discussion that we've had there. And then all of a sudden it got into the therapeutic thing. Let's help them recover more rapidly so they're ready to go next time more efficiently. And but to that end, one more time, just take it out to use it as a precautionary type of thing or as a preventative type of thing before you have issues. I mean, if it's known that you're probably going to have it because your dad did or your mom did, you can maybe set that off and offset that by using the modality, as more of a preventative stay well wellness type of thing, and we're talking a lot about that. So good morning, folks. Thanks for being here with me. If you have any questions, just put them in the chat box here, and I'd be more than happy to answer them. So I have received a question the other day. Can I have magnetic wave or MagnaWave therapy on my hands? I have an InterStim implant for my bladder. And so the idea is you wouldn't want to use it necessarily over the bladder itself with the InterStim. Now, I need to look up InterStim and see if that's a powered device or what it is. If it's like a stent or something like that, then it should not be an issue. I will check that out here in a minute, but we can, here, let me just go over here and put it up here and we'll take a look. We'll just find out for sure. InterStim implant treats overactive bladder. I didn't get enough into it whether or not it said if it's a powered device, but we can get to that and you can look that up. Let's just assume that it is a powered device for this conversation to treat your hands away from, you can place your hand on a table and put it on a coil and treat your hands for arthritis or whatever you're doing with that type of device implanted. It's not like they're putting in defibrillators now and pacemakers that the doctors are saying as long as you're a foot or two away from it, arm's length, if you will, or at your ankles or your feet, they're allowing people to treat with the newer implanted devices. Older devices, they're still cautious because they don't want you to have any impact on the power supply that's coming. But there are folks that have various implants that they can charge. They have an apparatus on their body that they can charge the device so they can disconnect it, and it's certainly, if they clear with their doctor, certainly okay to treat with those types of devices. So it just depends on what the device is and what your proximity is to the device. Are you going to set it off with this device a foot away from it, treating your hand or your ankles or your feet or your knees? Probably not. And so that's just a great question, and I just wanted to have a look at it. Okay, any other questions? Jason, good good morning. Hope you're feeling better. Jason just had knee replacement surgery. You might tell us how you're doing, Jason. If you'd like to, if someone would like to call in and talk a little bit about what's going on, Jason, we'd love to keep up with what you're doing. 502-599-9722. 502-599-9722. If you'd like to call in, folks, just be sure to mute your speaker so we can give that a shot. Let's see here. We got a question. Let me bring that up here. Let me get rid of this. Okay, that's gone. InterStim is an implanted device that works off an implanted generator. It has leads that go from the generator to the nerve. Thank you, Serena, for making that very succinct so I didn't have to spend time reading it. So it's got an implanted generator. I would not treat directly over that area at all unless the doctor said, hey, it's not going to be an issue. But to certainly be away from it, if specifically if you're treating your shoulder or you're treating your elbows or your hands, should not be a particular problem. Check with the doc, but it should not be an issue because of the proximity to the device and how it operates. Serena, thank you very much for that clarification, so we can go with that. So let's see here, and then I received a question from a young lady this morning who's new to the device and what she's doing with it. She's going to be operating in a veterinarian's office. The veterinarian is going to work with her on this, and so she's going to be developing her practice right out of the veterinarian's office, and the veterinarian's for that. But the veterinarian doesn't know much about the therapy, about the modality, and she's asking questions. How can I best bring him up to speed to show him the validity? You know, a lot of people think that it's hocus pocus, or a lot of people don't really understand what it's doing and how it works. Even though we talk about it here and we cover those types of conversations every day with the validity of what we are doing. What I would recommend if someone wants to do that is to simply go to our website and go to the information area. There's listings of studies. Go to the testimonial page. There's testimonial after testimonial dealing with humans, small animals, and horses, showing what it does. We also have research of the studies that we have done, performed with our equipment for various indications: lumbar pain, knee pain, prostate issues. That we have done these studies and we have the results, and they are peer reviewed studies. They're published in journals, and so there we did them out of country. We did them in Cuba, and so some people think that's good, bad, or indifferent, but that's where we were able to get it done and at reasonable expense, and so that's how we pursued that. But at any rate, the information is pretty much there on the website if somebody wants to get into it. The MagnaWave News and Views is another great place if you want to give it to somebody, because it's more than anything, it's the website in a newspaper form that somebody can read, and it's got doctors' information there, veterinary information, reprints of articles that have been done, talks about the various studies that are being performed. So there's a lot of credibility there that people can see, and it's nothing that someone has to search very deeply for if they are in fact wanting to know more. So that's my recommendation to the young lady, and which I will share with her. But the information is certainly there, and we have it on the website, and we've gone to great lengths to make sure that the website is presented in a very professional fashion, very in-depth, so those questions can be answered. People do say, well, that's your website, and you're certainly going to say that. Yes, but they are unrequested testimonials, and the studies are studies, and we take you to the AOPP website where you can find thousands of studies that have been completed over the years with PEMF, and so it again speaks to the validity even in a third-party fashion. So great question, and that's how I would approach it. We do have materials available if anybody needs that to better fully explain. Okay, let's see. Jason's got an update here. Let's pull this up. Let me come over here real quick. Do this. Bring up Jason's. See how he's doing with his Second day on physical therapy, not real thrilled about the first day. My sister-in-law just had knee replacement, Jason, and she said the therapy almost killed her. I mean, it's really tough, but they got to do it, and you got to go through it. Everything is good. Physical therapy's text saying I should be released from the hospital in the next couple of days. That's good. PT techs are very interested in MagnaWave, just trying to get them to let me use it here before I leave. You know, and that's a challenge. When I've had so I know some people have taken their device or one of their devices to the hospital or the physical therapy rooms or the units that they're in. My good friend, we have a low-power device called the LP, and a good friend of mine had knee replacement surgery maybe 2 or 3 years ago now, and I took him a unit to the hospital, and he put it on the whole time he was there, and the doctors looked at it, saw that he was using it, and it gave him a lot of relief and helped out. Not as much relief as rapidly as you get from the big machine, but it did give him some relief quickly and made things easier for him in his recovery. My sister-in-law, who just had a knee replacement, the doctors were amazed at how well she was doing after 2 or 3 weeks, the inflammation, the movement, the whole thing. And Jason, I hope you're successful in getting them to let you treat yourself. It'd be interesting for them. Just tell them to let me do it to show you. Let's consider it a little study here in the hospital or in the room. Let's do this and let your doc look at it and see what it is. They may very well go along with that. I understand they've got their. I once treated a woman, and we want to go there. I said we'd do that at the beginning of the conversation. Jason, thanks so much for the update, and I hope everything's going to go well as you continue recovery. But once had a woman who had a stroke, and in Lexington, and her husband calls me and said he's a very big user of MagnaWave. He's got a bunch of machines. He's very successful in the horse racing business, and wanted me to come down and treat his wife in the hospital. And I said, they're not going to let me do that. That's not going to happen. Oh yeah, come on down. They're going to let you in. And come in this door and come down this way, and everything's fine. And he had cleared it all with his doctors, and so we went and treated his wife for some shoulder pain and to help her regain some cognition. And we started seeing some very good results with that. With improved cognition. The quicker you get, studies have shown, the quicker you get to a person who has had a stroke or that type of situation, the more rapid the result that you receive. The more rapid things turn around for the better. The longer you wait, and we did have one case, a gentleman that we treated for a few years, that he was 3 or 4 years out from his stroke when we began to treat him, and the local facilities had said, we've done everything we can do. He suffered from aphasia, and we've done everything we can do, and it's not going to get any better. And we said, can we work with him? And they said, sure, we'd like to see what happens. And we worked with him daily, and we were able to, over years, get his aphasia improved by, we felt, 30 to 40%. He can make sentences, excuse me, recognize things in the air, butterflies. He could say things. He was formerly a concert promoter, and he would come in and point to the name. Now I can't think of the guy's name. Jimmy Buffett. He'd point to the name of Jimmy Buffett, and we'd talk about Jimmy Buffett. Over time, he'd come in and he'd say Jimmy Buffett, and we'd talk about concerts, and so it worked out very well. So from those types of things, and that brings me a little bit to the depression area and what people can do. We learned early on when we were using this, and people were treating themselves and treating horses. When you would treat the poll of a horse, that its demeanor would improve, its concentration would improve, the horse would be more responsive to the requests that you were making of it, and that type of thing. Same thing in animals. It's very relaxing. So we learned that it was relaxing, that it provided a sense of well-being to the people and the animals that we were treating. People would say that, gee, I just feel better. I feel relief all over when I treat myself. Not even a particular indication, or but we'd have people who we'd be treating their pain, and their pain would be better, and their sense of well-being would also kind of improve. And then, of course, the modality of PEMF is approved for treating depression and anxiety and autism types of clients with autism, but it as a treatment for depression. And we've learned that we can apply our device to the body, and people feel better. They have a better sense of well-being. And so, if someone is depressed, and and they're telling you they're depressed, treat them. Have them lay down and get some rejuvenation energy into their body, and some energy supplementation, as I like to call it, and supplement themselves and have better blood flow and better oxygenation and just feel good. And that could change the whole dynamic of how somebody is doing. And we have a young lady that came in here, I guess it's been almost 3 years ago now, 2.5 years ago, clinically non-responsive depression. They had tried everything, the electrical stimulation, the TMS device, which is a PEMF therapy type of device, but all kinds of medications, all kinds of voice or communication type of therapy, and there's an area called clinical non-responsive, to where things just don't work. And this gal came in here, and lovely lady, but just severely depressed, and we began treating her daily, and we would put the loop over and just sensually over her shoulders and her head, and just work the area for feeling better and a sense of well-being. And she was unable to work, she was on disability, and it just when she first came in, the sadness that was on her face, the way she walked, the whole 9 yards, was just sad. And but over time, she and there's not a lot of times, in just a matter of 6 to 7 weeks, she was smiling, she was better, and but it was consistent. We had to stay consistent, and after about a year of being regularly treated, she purchased her own machine, and she has it at home. So now she treats herself. I think she told me she'll be speaking at MagnaCon, which starts tomorrow evening, but she's telling me that now she's treating herself 3 or 4 days a week. You have to treat herself 7 days a week. So when she feels something come on, she treats herself, lays on the coil, puts it over her head, on her shoulders. And so it has really changed her. She's back working. She is going to be at MagnaCon speaking. She smiles. She moves. It's phenomenal what we saw happen with her, just from the idea of trying to sense of well-being, improve sense of well-being, and improve her health and wellness. And so, that's what I was talking about earlier. This is something that could lend some result to somebody. And so if you have somebody in that situation, see if they'll let you work with them. If you're a practitioner, if you're someone that has bouts of depression or something, and you don't know what to do, and you've done other things, and find a practitioner near you, and lay down, and let them put this on your back, shoulders, and see if it gives you some relief. No guarantees, don't know. I mean, we don't diagnose anything. We don't treat any conditions. We're just trying to improve the body's health and wellness so it's in a better position to heal itself. A doctor, on the other hand, and we'll have doctors at MagnaCon as well, can certainly talk about depression. Dr. Dreesen will be dealing with neurological issues as we talk about those types of things at MagnaCon. If you're close by and you want to join us at MagnaCon, there's a couple spaces left. Come on in, get on the plane, get in the car, drive over from wherever you happen to be if you're in a driving distance, and join us. Call the office today if you'd like to talk about that. I can give you that number. Let's see if I got that. I don't have that number up here. It's 502-742-7868. 502-742-7868. Let's see. I got that question answered. So, You know, again, can it be very preventative? Yes. Can it be used as a pre-event, pre-stress situation? Yes. We're working now with the Jacksonville Jaguars, have some machines in place and utilizing them for the team and seeing some very good results there. And so we're excited about that. Working with the professional athletes, you know, again, it's the same thing. The sooner you get after a problem when it develops, the better the result and the more rapid of a result that you receive. So, okay, if there's no other questions, we don't want to keep you just hanging on here, and I don't want to just babble and do that, but I do want to answer any questions that you may have when it comes to, oh my goodness, there's a, let's see here, let me pull this up. It's a long one. Let me see if we can get it here and take a look at it. Okay, from Terry. I've been treating 6 or 7 horses in a dressage stable that have some stiffness in shoulders and backs. All have responded really well, and owners, trainers saying they can really feel the difference in the rides after. One of the horses doing especially well, but he will doing a sort of quiver, just as if he's still feeling the pulse, especially in his shoulders when I've moved to the other areas of the body or even a bit after treatment. He's the only one I've had do this. Significant? Any concerns with this? Okay, so what she's saying is when she treats, if she's treating the shoulder and she goes on to another area, she continues to get some movement in that area. It's not unusual for this to happen. It doesn't happen often. A lot of times people talk about it could be an electrolyte shortage in the body. Make sure they are well hydrated. But it's kind of like you'll get a twitch when you kind of got a Charlie horse coming on, or you get a little twitch in your muscle, and you can feel it doing that. That's what it's doing. You've stimulated the area, the muscle or the nerve, and the area is taking that energy. And so when you leave, it is still firing, if you will. And is it concern to worry about? No. It'll subside and go away. People have had that type of situation. I can only say in my years when I was actively treating every day that I saw it just a few times. But, you know, now they are saying that it could be a hydration issue, or it could be electrolyte imbalance, vitamin shortage, or something like that. So you want to check that out. But it's not a serious issue or anything that you need to be overly concerned about, or is something that will cause problems. Great question. Thank you for asking, folks. If you have any other questions, just put them in the chat box, and I'd be happy to address them at this time. Let's see what else is going on. MagnaCon is going to start tomorrow, so we're excited about that. I'm going to be talking, and some of this will be available if you're a practitioner and you want to use the MagnaCon experience as your continuing education to renew your certification. If you're not going to be able to join us, that will be available for you to do that. And so that it'll be coming shortly after MagnaCon. For those of you had a question the other day from a young lady, or actually last night from a young lady who is certified, and she's coming up for recertification, and it'll be, her certification will come up before next year's MagnaCon, and she wants to make sure that she can get it. Well, we will have continuing education available to those folks in that situation so they can redo their certification. And you know, people have asked me, well, I'm certified, why do I need to be recertified? Well, because we want to make sure that you're up on the latest things taking place. I want to talk about Bob Dennis in a minute. Taking place in the industry, so you are up on, so we're all talking about the same thing, so you're familiar with the studies that have occurred, so you're familiar with how it's being utilized. And while our certification is for our practitioners, it means that they are taking the time to study and understand this therapy and to go forward with it. We do have some racing jurisdictions that require that the people are certified before they can come into the racing jurisdiction or before they can work in particular areas. So it's not a requirement that someone is certified. It's not a state requirement that someone is certified. We're trying to have the education deep enough, broad enough, and good enough that when those days come that the states say, okay, we want to do something with licensing with this type of therapy, if they ever do that, and we want to be able to say, here's an education process that people can take or have taken that sets them, I don't want to say sets them apart from everybody, because there's a lot of very smart people out there, but sets them apart that they have studied and they have keep their education up to date with regard to certification. So that's what will be happening there. But Bob Dennis, talking to him just Monday or Friday it was, and he's telling me that in his presentation at MagnaCon, he's going to be talking about elements of the NASA study that have really never been discussed, never been put out there with regard to the effects of PEMF on the body. So we're going to get some new information that we'll be able to share that really hasn't ever been shared, that NASA and he found out in their studies of PEMF. So I'm excited about that very much, and talking with Bob Dennis at MagnaCon. Okay, let's see. Here's another question. My dog just had ACL surgery and has fishing line wire like stitches that do have a metal throughout them. Would it be best to wait and do the treatments after she gets them removed? Typically, stitching, metal, things like that are not an issue. You can treat the area, which I would recommend with an ACL type of surgery, to make sure that the healing is good and as quickly as possible, so you don't have stress from the, they don't know. An animal's not like us. They can tell us to sit down and we'll sit down and maybe not do anything. Whereas an animal, it wants to go and it wants to do, and all of a sudden it stresses itself, and now you just had a surgery and it's stressing itself. So speed of healing becomes potentially an important factor. So if your vet says it's all right and you can treat the area, I would approach it and simply treat the area and see if the dog is comfortable. If the dog is uncomfortable because of the potentiality of the stitch warming a bit, then you'll know, because they won't be comfortable, or you could be able to feel it and see. But typically, staples, stitching, screws, rods, we've never had any issue. The only time that we're really aware of an issue was a woman had an implant in her breast as a target for radiation therapy, and it was so small and so minute in size that it did warm during treatment, and she could tell. This is not one of our patients. This is third-party shared information, but that's the only time. Typically, now we always say in our materials, take caution when someone has metal implants, test, make sure that they're comfortable, and that's the best way to do it. If someone has a shoulder replacement or a knee replacement, treat the area, make sure they're comfortable, make sure they don't feel any heat or anything like that, and if they don't, then there should be no reason at all that you couldn't treat those areas with doctor's approval, certainly, as a disclaimer. So good question, and I would treat your animal today, and hopefully everything will be great. Any other questions, folks, just put them in the chat box, and I'd be happy to answer them. I'm trying to think. I did tell you about Bob Dennis, and we're anxious to hear what he's got to say with regard to the NASA study and the state of PEMF today. He's watched it because he was so implemental in the NASA study, and so many people refer to the NASA study when they talk about PEMF and its effects and how it can aid the body, and he's watched this industry basically blossom thanks to him in many ways, and other people who have done studies and have worked very hard. And so he's going to talk a little bit about, and we'll share this certainly, about the state of PEMF today and how he's seeing it impacted, and how he's seeing some things happening with regard to health and wellness. So no other questions coming through. If you do, I'll give you I'll hang around here for another minute or so. See what's going on. If you have any questions, I certainly appreciate you being with me today, and it's always fun to answer your questions as best I can, and that's what we're all about. We feel that one of the qualities of MagnaWave is our depth and quality. We try to go in depth in our research and our education, and we try to have quality of giving you the information that you're looking for, and so supporting our equipment and best practices and how it can be utilized. So I think things have kind of quieted down here a little bit. I certainly appreciate you being with me, and I will be back next Tuesday. MagnaCon starts tomorrow, and we're excited about that. So thank you for joining me, and Wave. Oh, did we get something here? Any new comments? Let's see here. Oh, we do have one. Here we go. Let's see. Jason asks a question. Will there be videos of the speakers like Mr. Bob available for after MagnaCon? Unfortunately and obviously, I'm not going to make it. Yes, Jason, we will have the videos available that we will be posting and having available for training, additional training, and so forth. So great question. I know you won't be able to be here because of your surgery. I'm excited that you're doing better and that you're feeling so you're ready to get back to work. I always enjoy keeping up with you. If you folks look up Jason Bill on Facebook, he posts a lot of good information, and he's a great guy, and he's himself, and that's incredible that Jason is himself, can be himself, and can share his information with his clients and the world as he often does. Let's see here. Thanks, Jason. So yes, that'll all be available for you to have available. Okay. So, Jennifer, thank you for the thumbs up. And again, thank you for joining me. I look forward to being back next week. Have a great week. Wave on and be healthy and happy. See you later. Bye-bye.